Susan DeVore, the healthcare sector in the S&P was down 10% in the third quarter. Nevertheless, your company, Premier, is up 7% year-to-date, certainly beating the entire S&P. So can you talk about why Premier has been able to beat the market? What's your correlation to the healthcare sector, too?
So we are in healthcare improvement, and I think the reason we're beating the market is we're actually bringing solutions to solve the problems of the healthcare players. So we wake up every day saying we can impact 120 million people and improve the quality and safety and cost of healthcare. And so we're a solution.
And you actually raised your yearly guidance last week because of the addition of a government contract. Can you talk about that government contract? Is it recurring? Is it a one-time thing? Can you talk about it?
So this is a government contract that we had for a period of 3 years. It's all around how do you improve safety and lower readmissions to hospitals. We had great performance under the first contract. This is a contract extension. It's for 1 year, and we don't know what happens after that.
And where are the big inefficiencies in hospitals right now?
You know, healthcare is a very fragmented system, and so there are inefficiencies in a lot of places. Pharma cost is of great concern to health systems. The coordination of care, the duplication, the lack of interoperability, all of that creates costs in the healthcare systems, and Premier is bringing technology and services to try to solve those problems.
Let's talk about that technology. You've been buying some cloud-based companies recently,
yes.
A slew of them. So talk about how this helps you lower costs at hospital and boost your profit margins.
So we have massive data assets. They've all been in the cloud: clinical data, financial data, operational data. We just acquired 3 companies. They're all helping us with ambulatory data, the data in the physician practices, because we believe you can't solve this problem unless providers and patients make clinical and economic decisions differently.
And there's more patients than ever because of Obamacare. We keep hearing that hospitals are bustling. So talk about Obamacare's relation to your business.
So Obamacare has brought 16 million more patients and access to care to 16 million through the exchanges. Medicaid has expanded. That's created a lot of additional costs for services in healthcare systems. It's also created the need for business intelligence to really make the system more efficiently, and that's where Premier plays. We bring business intelligence to this.
And what about keeping people's medical information private? We've been hearing a lot about hackings. Now people are hearing things are going in the cloud. It's going to unnerve a lot of people, especially when it comes to their medical data.
So we have 40% of the data on patients in this country, and we've had it for many, many years. So all the HIPAA rules, all the privacy protections, all the cybersecurity work is very important to us because that individualized data needs to be protected. But the learning and the improvement actually comes from being able to look at the data across geographies and across diagnoses and figure out how you're really going to improve cost and quality.
And then finally, where can you take your technology and your strategy outside of healthcare? What's the next move?
So we think the challenges of healthcare are so big, and we have relationships with suppliers, with government, and with all these health systems. This is a multi-decade, one of the most significant economic and social challenges of our time, and I wake up every morning thinking about the 120 million people we can impact by improving healthcare.
So you still have a lot of work to do.
We have a lot of work to do.
All right, well, thanks a lot, Susan.
Thank you.
And thank you for watching The Street.